Hello, I am Dr. Vivek. Today I am going to talk about emergency triage, which I recently attended, arranged by Jiva Raksha Trust. So, why we should know triage? ನಮ್ಗೆ ಟ್ರೈಜ್ ಯಾಕೆ ಗೊತ್ತಿರಬೇಕು? ಒನ್ ದಟ್ ಈಸ್ ಐಡೆಂಟಿಫೈ ಪೇಷಂಟ್ ರಿಕ್ವೈರಿಂಗ್ ಇಮಿಡಿಯೇಟ್ ಕೇರ್. Second, understanding triage and color coding. Third, use of triage scale in terms of time to treatment. Differentiate the disaster triage and non-disaster triage. So these are the objectives of knowing triage. One, the to ಯಾವ ಪೇಷಂಟಿಗೆ ಇಮಿಡಿಯೇಟ್ ಕೇರ್ ಬೇಕಂತ ಗೊತ್ತಾಗಬೇಕು. ಎರಡನೇದ್ದು ಯಾವ ಕಲರ್, ಆಮೇಲೆ ಟ್ರಯೇಜ್ ಅಂದರೆ ಏನಂತ ಗೊತ್ತಾಗಬೇಕು. ಮೂರನೇದ್ದು ಈ ಟ್ರಯೇಜ್ ಮಾಡಿದ ಮೇಲೆ ಎಷ್ಟು ಟೈಮ್ ಒಳಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗಬೇಕು. ಆಮೇಲೆ ಟ್ರಯೇಜ್ ಡಿಸಾಸ್ಟರ್ ಆದಾಗ ಮತ್ತು ನಾನ್ ಡಿಸಾಸ್ಟರ್ ಆದಾಗ ಹೆಂಗೆ ಮಾಡ್ಬೇಕಂತ ಗೊತ್ತಾಗಬೇಕು. ಇಂಟ್ರೊಡಕ್ಷನ್. ಟರ್ಮ್ derived from French verb meaning to sort or to choose. Triage means a fundamental intervention to manage patient flow safely and to ensure the patient who need immediate medical attention are treated timely and particularly in case of overcrowding. So triage ಯಾಕೆ ಮಾಡಬೇಕು? ಟ್ರಯೇಜ್ ಅಂದ್ರೇನು? ಬಿಡಿಸೋದು. ಸೊ ಟ್ರಯೇಜ್ ಮಾಡಿದ್ರೆ ಏನಾಗುತ್ತೆ ಅಂದ್ರೆ ರೈಟ್ ಪೇಷಂಟ್ಗೆ ರೈಟ್ ಜಾಗದಾಗ ರೈಟ್ ಟೈಮಿಗೆ ರೈಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗ್ತೈತಿ. ಟ್ರಯೇಜ್ ಅಂದ್ರೆ ಈಗ ಪೇಷಂಟ್ಸಿಗೆ ಬೇರೆ ಬೇರೆ ಇದ್ರಾಗ ಡಿವೈಡ್ ಮಾಡೋದು. ಸೊ ಬೇರೆ ಬೇರೆ ಡಿವೈಡ್ ಮಾಡಿದ್ರೆ ಅವ್ರಿಗೆ ಕರೆಕ್ಟ್ ಪೇಷಂಟಿಗೆ ಕರೆಕ್ಟ್ ಜಾಗದಾಗ ಕರೆಕ್ಟ್ ಟೈಮಿಗೆ ಕರೆಕ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಸಿಗ್ತೈತೆ. ಸೊ ನೆಕ್ಸ್ಟ್, ಟ್ರಯೇಜ್ ಎಷ್ಟು ಟೈಪ್ ಇರ್ತಾವೆ? ವಾಟ್ ಆರ್ ದ ಟೈಪ್ಸ್ ಆಫ್ ಟ್ರಯೇಜ್? ಒನ್ ಈಸ್ disaster or mass casualty, to provide most effective care to greatest number of patients. Disaster or mass casualty ಅಂದರೆ natural calamities like bus accident, earthquake, bomb blast or road traffic accident and many other disaster, that is natural disaster or mass casualty. In non-disaster or emergency department triage, to provide best care to individual patient. When the patient comes to casualty emergency department, then we have to give best possible treatment to a person who comes to casualty. So triage ಯಾವಾಗ ಬೇಕು ಅಂತಂದ್ರೆ ಒಂದು ಆಕ್ಸಿಡೆಂಟ್ ಆರ್ ಮಾಸ್ ಕ್ಯಾಜುಯಾಲಿಟಿ ಆದಾಗ, ಇನ್ನೊಂದು ಎಮರ್ಜೆನ್ಸಿ ಡಿಪಾರ್ಟ್ಮೆಂಟ್ದಾಗ. These are the aims of triage. So first we are going to discuss what is called as non-disaster triage or emergency department triage. Internationally there are 5 triage scales shown to be valid, reliable for categorizing patients seeking treatment. World ಒಳಗೆ 5 type triage system ಅದಾವ, but in rural settings we use ಸಿಂಪಲ್ 3 ಕಲರ್ ಕೋಡ್ ಸಿಸ್ಟಮ್, ಅಂದರೆ 3 ಕಲರ್ ಸಿಸ್ಟಮ್ ಯೂಸ್ ಮಾಡ್ತೀವಿ. ಒಂದಂದರೆ ಟ್ರಯೇಜ್ ಲೆವೆಲ್ 1 ಝೋನ್ ಕ್ಯಾಟಗರೈಸೇಷನ್, ರೆಡ್ ಝೋನ್, ಟ್ರೀಟ್ಮೆಂಟ್ ರಿಸಕ್ಸಿಟೇಷನ್. ಲೆವೆಲ್ 2 ಯೆಲ್ಲೋ, ಟ್ರೀಟ್ಮೆಂಟ್ ಟೈಪ್ ಈಸ್ ಅರ್ಜೆಂಟ್. ಲೆವೆಲ್ 3 ಈಸ್ ಗ್ರೀನ್, ಇಟ್ ಈಸ್ ಲೆಸ್ ಅರ್ಜೆಂಟ್. ಸೊ 3 level categorization is easy to follow in rural settings. So what is level 1 or red zone? Resuscitation. Patient in this category are those having immediate threat to life or limb. Time to nurse and physician assessment is immediate. ಇಂಥ ಕಂಡೀಷನ್ ಒಳಗೆ ಪೇಷಂಟ್ ಜೀವಗೆ ಇಲ್ಲ ಭಾಗಕ್ಕೆ ಜೀವ ಹೋಗೋ ಸಾಧ್ಯತೆ ಅಥವಾ ಭಾಗ ಹೋಗೋ ಸಾಧ್ಯತೆ ಇರುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ನರ್ಸ್ ಅಥವಾ ಫಿಸಿಷಿಯನ್ ಇಮಿಡಿಯೇಟ್ಲಿ ತಕ್ಷಣ ನೋಡಬೇಕು. ಅದಕ್ಕೆ ರೆಡ್ ಝೋನ್ ಅಂತಂತಾರೆ. ಸೊ ರೆಡ್ ಝೋನ್ ಒಳಗೆ ಏನೇನು ಬರ್ತದೆ ಅಂದ್ರೆ ಕಾರ್ಡಿಯಾಕ್ ಅರೆಸ್ಟ್, ಹಾರ್ಟ್ ಸ್ಟಾಪ್ ಆಗಿದ್ದು, ಮೇಜರ್ ಆಕ್ಸಿಡೆಂಟ್, ಮೇಜರ್ ಟ್ರಾಮಾ ಅಂದರೆ ಆಕ್ಸಿಡೆಂಟ್ ಆಗೋದು, ಭಾಳ ಗಾಯಪಟ್ಟಾಗಿರಬೇಕು. ಆ್ಯಕ್ಟಿವ್ ಸೀಸರ್ಸ್ ಅಂದರೆ ಫಿಟ್ಸ್ ಬಂದು ಪೇಷಂಟ್ ಫಿಟ್ಸ್ ಹೊಡಿತಿರ್ತಾನೆ. ನೆಕ್ಸ್ಟ್ ರಕ್ತ ಹೋಗಿ ಪೇಷಂಟ್ ಸಾಯೋ ಸ್ಥಿತಿಗೆ ಬಂದಿರ್ತಾನೆ. ಉಸಿರಾಡ್ಸೋ ದಮ್ಮು ಉಸಿರಾಡ್ಸೋ ತ್ರಾಸಿರುತ್ತೆ, ಎದೆ ನೋವು ಆ್ಯಂಡ್ ಹಾರ್ಟ್ ಅಟ್ಯಾಕ್ ಬಂದು ಎದೆ ನೋವು ಬಂದಿತ್ತು ಅಂತಂದಾಗ ರೆಡ್ ಝೋನ್ ಒಳಗೆ ಪೇಷಂಟಿಗೆ ಡಿವೈಡ್ ಮಾಡ್ತೀವಿ. ನೆಕ್ಸ್ಟ್ ಯೆಲ್ಲೋ ಝೋನ್ ಅಂದ್ರೆ ಅರ್ಜೆಂಟ್. In this, patient is present with potential threat to life, limb or function. In this we can wait for some time, that is from time to nurse assessment less than 20 minutes, time to physician assessment less than 30 minutes. ಎಕ್ಸಾಂಪಲ್ ಅಂತಂದರೆ ಪೆನಿಟ್ರೇಟಿಂಗ್ ಫಾರಿನ್ ಬಾಡಿ ಆಫ್ ದಿ ಐ, ಅಂದರೆ ಕಣ್ಣಿಗೆ ಗಾಯ ಆಗಿದ್ದು, ಏನಾರ ಚುಚ್ಚಿದ್ದು, ಮೈಲ್ಡ್ ಟು ಮಾಡ್ರೇಟ್ ರೆಸ್ಪಿರೇಟರಿ ಡಿಸ್ಟ್ರೆಸ್, ದೆನ್ ಮೈಲ್ಡ್ ಚೆಸ್ಟ್ ಪೇನ್, ಹೊಟ್ಟೆ ನೋವು, ತಲೆನೋವು, ಹೆಡೇಕ್ ವಿತ್ ಫೋಕಲ್ ಸೆನ್ಸ್. Headache with focal sense and telenow with weakness of limb or any other focal localizing sign. This is erosion. In this we can wait up to 30 minutes. These need urgent treatment. These are not so much emergency. Then next is, this is level 4, that is green zone or less urgent. This conditions with mild to moderate discomfort. Mild to moderate discomfort ಅಂದರೆ ಅವ್ರು ಜಾಸ್ತಿ ತ್ರಾಸ ಇರೋಂಗಿಲ್ಲ, ಅದಕ್ಕೆ 1 ತಾಸು ಬಿಟ್ಟು ನೋಡಿದರೂ ಬರ್ತೈತಿ. ಅದಕ್ಕೆ ಟೈಮ್ ಟು ನರ್ಸ್ ಅಸೆಸ್ಮೆಂಟ್ ಈಸ್ ಲೆಸ್ ದೆನ್ 1 hour ಆರ್ ಟೈಮ್ ಟು ಫಿಸಿಷಿಯನ್ ಈಸ್ ಲೆಸ್ ದೆನ್ 1 hour. ಎಕ್ಸಾಂಪಲ್ ಅಂದ್ರೆ ಏನು, ಗ್ರೀನ್ ಝೋನ್ ಒಳಗೆ ಯಾವ್ಯಾವ ಬರ್ತಾವೆ ಅಂತಂದ್ರೆ ಡಿಪ್ರೆಷನ್ ವಿತ್ ನಾನ್ ಸುಸೈಡಲ್ ಅಟೆಂಪ್ಟ್, ಲೋ ಗ್ರೇಡ್ ಫೀವರ್, ಸೋರ್ ಥ್ರೋಟ್, ಮೈನರ್ ಟ್ರಾಮಾ, ಇಯರ್ ಪೇನ್. ಸೊ ಡಿಪ್ರೆಷನ್ ವಿತ್ ನಾನ್ ಸುಸೈಡಲ್ ಅಟೆಂಪ್ಟ್ ಅಂದರೆ ಖಿನ್ನತೆ ಒಳಗೆ ಸುಸೈಡ್ ಮಾಡೋ ಇದು ಇರೋಂಗಿಲ್ಲ. ನೆಕ್ಸ್ಟ್ ಸಣ್ಣ ಪುಟ್ಟ ಜ್ವರ, ಗಂಟ್ಲು ನೋವು, ಸಣ್ಣ ಪುಟ್ಟ ಗಾಯ, ಆಮೇಲೆ ಕಿವಿ ನೋವು, ಇದಕ್ಕೆ ವೇಟ್ ಮಾಡ್ಬೋದು, ಅವು ಅರ್ಜೆಂಟ್ ಇರೋಂಗಿಲ್ಲ. ಸೊ ಅದು ಗ್ರೀನ್ ಝೋನ್ ಅಂತ ಕೊಡ್ತೀವಿ. ನೆಕ್ಸ್ಟ್, ವಾಟ್ ಆರ್ ದ ಬೇಸಿಕ್ ಕಂಪೋನೆಂಟ್ ಆಫ್ ಟ್ರಯೇಜ್? ಒನ್ ಈಸ್ ಟ್ರಯೇಜ್ ಹಿಸ್ಟ್ರಿ, ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್, ಟ್ರಯೇಜ್ ಡಿಸಿಷನ್. ಟ್ರಯೇಜ್ ಹಿಸ್ಟ್ರಿ ಅಂತಂದರೆ ಈಗ ಪೇಷಂಟ್ ಬಂದಮೇಲೆ ಅವ್ರಿಗೆ ಏನು ತ್ರಾಸ ಐತೆ ಅಂತ ಕೇಳ್ಬೇಕು. ಅದು ಹಿಸ್ಟ್ರಿ ಅಂತಂದರೆ ಎಲ್ಲ ಕೇಳ್ಕೊಂಡು ಕುಂದ್ರಂಗಿಲ್ಲ, ನಿನ್ನೆ ಮೊನ್ನೆ ಏನು ಮಾಡಿದ್ದು ಕೇಳಂಗಿಲ್ಲ. ಈಗ ಸದ್ಯಕ್ಕೆ ಎಮರ್ಜೆನ್ಸಿದಾಗ ಬಂದಾಗ ಏನು ತ್ರಾಸ ಆಗೈತಿ, ಬರೋಕೆ ಏನು ರೀಸನ್ ಅಂತ ಕೇಳಬೇಕು. ನೆಕ್ಸ್ಟ್ ಈಸ್ ಫಿಸಿಕಲ್ ಎಕ್ಸಾಮಿನೇಷನ್, ಫಾಸ್ಟ್ ಹೆಡ್ ಟು ಟೋ ಎಕ್ಸಾಮಿನೇಷನ್, ಫ್ರಮ್ ಹೆಡ್ to head, neck, chest, abdomen, limbs, head to toe examination. And next, along with history and physical examination, triage decision. These are the component of basic triage component. Next, triage history ಒಳಗೆ ಏನು ಬರ್ತೈತೆ ಅಂತ ಆಗಲ್ಲ ಹೇಳ್ದಂಗೆ, patient identity details, brief and focused history. In physical examination we have airway, breathing, circulation, disability and vital signs. This is physical examination. Then triage decision. After seeing history and physical examination, quickly categorize the patient into appropriate zone and treat accordingly. Zone andre red zone, yellow zone, green zone. ರೆಡ್ ಝೋನ್ಗೆ ಇಮಿಡಿಯೇಟ್ ಟ್ರೀಟ್ಮೆಂಟ್ ಬೇಕು, ಯೆಲ್ಲೋ ಝೋನ್ಗೆ ಅರ್ಜೆಂಟ್ ಅಂದರೆ ಲೆಸ್ ದೆನ್ 20 minutes, ಆ್ಯಂಡ್ ಗ್ರೀನ್ ಝೋನ್ ಅಂದರೆ 1 ತಾಸು ತನಕ ಕಾಯ್ಬೋದು, ಅರ್ಜೆಂಟ್. Then this is the description of triage by the nurse. When the patient comes to casualty, the nurse will see patient and she will write her description in triage. That is time of arrival, triage start time, method of visit. Patient ನಡ್ಕೊಂಡು ಬಂದಾನೋ ಅಥವಾ patient has come through ambulance, what is the chief complaints, ಏನು ತ್ರಾಸ ಅಂತ ಬಂದಾನ. Then triage level 1 2 3 4 5 or red, yellow, green. Triage decision time ಯಾವಾಗ, ದೆನ್ triage decision reason, critical first look, vital signs, symptoms, previous history, others. Number of patients waiting for the physician in waiting room. Then next is description by emergency physician. Then examination time, doctor ಎಷ್ಟು ಗಂಟೆಗೆ ನೋಡಿದ್ರು, triage level red, green, yellow. Then treatment ಏನು, if the ಪೇಷಂಟಿಗೆ ಮನೆಗೆ ಕಳಿಸ್ಬೋದಾ ಅಥವಾ ಹಾಸ್ಪಿಟಲ್ದಾಗ ಅಡ್ಮಿಟ್ ಮಾಡಬೇಕು ಅಥವಾ ಬೇರೆ ಹಾಸ್ಪಿಟಲ್ಗೆ ಕಳಿಸ್ಬೇಕು ಅಥವಾ ಡೆತ್ ಆಗುತ್ತೆ. ನೆಕ್ಸ್ಟ್, ಸಮ್ ಕೇಸ್ ಪ್ರೆಸೆಂಟೇಷನ್. 32-year-old male presents with 2-hour history of increasing shortness of breath. He has audible stridor, wheezing sound caused by disruptive airflow and is unable to speak. He has respiratory rate of 36 breaths per minute. Maximal use of accessory muscles oxygen saturation is 92% despite supplemental oxygen at 10 liters per minute. His heart rate is 132. His skin is pale, cool and moist. What features of this patient presentation would make him level 1 triage zone? This 32-year-old male is there. He is having history of shortness of breath. This is the triage history. Then examination, physical examination. Physical examination order A, B, C, D. A, B, C, D. In A, patient is having difficult audible stridor, so airway is affected. Then breathing is 36 breaths per minute, so breath rate is increased. Then saturation is 92% with 10 liter of oxygen, so he is having breathing problem, and heart rate is 132, and he is having pale, cool and moist, which indicates circulation is affected. Then but he is conscious, so he comes in the red level 1 or red zone of triage. In second, the 22-year-old male presents with painful deformed left shoulder. Patient states that he was helping friends to move house when a book fell on him. He has respiratory rate of 26 breaths per minute and no use of accessory muscles. His heart rate is 118. His skin is pale, cool, moist. What are the features of this patient presentation would make him triage to trigger triage zone 2, that is yellow zone? One is history. He had he was working and a book fell on him, and there is deformed left shoulder. Airway, except respiratory rate of 26 breaths per minute, his airway is okay, breathing is normal. Then his heart rate is 108, it's comparatively normal, and his skin is pale, cool and moist. So he might have trauma to the chest, requiring immediate care within 20 minutes. So he comes into dry zone. His skin is pale, cool and moist. He comes in yellow zone. Next is a 40-year-old male presents with minor laceration of his right forearm. Patient states that he was renovating his kitchen and cut in his hand on a piece of wire. The laceration is 1 centimeter in length, is well approximated, not bleeding. He has a respiratory rate of 16 breaths per minute. His heart rate is 76. What features of the patient would make him try zone 3, green zone? The patient is not having airway, breathing, circulation or disability, but he is having a hemorrhage, but it is not bleeding profusely. So he comes in green zone and he can wait for 1 hour. These are the category 1, category 2, category 3, that is airway, breathing, circulation and disability. Airway obstructed, these are the priorities in which we have to see. If the disability GCS is less than 9, the patient is in category 1. If it is 9 to 12, category 2, and normal GCS is category 3. Then next is pain assessment. A majority of patients attend to emergency department have some degree of pain. The degree of pain influences the urgency. Patient in pain can become more aggressive and agitated. Source of distress, stress to both staff and other patients. The adequacy of pain management is a criteria for patient satisfaction. Patient have an expectation that their pain will be dealt with. What does this slide? ಈ ಸ್ಲೈಡ್ದಾಗ ಏನಂತಂದ್ರೆ ಪೇಷಂಟ್ ಯಾರಿಗೆ ನೋವು ಐತಿ ಅವರು ಅರ್ಜೆಂಟಾಗಿ ನೋಡ್ಬೇಕಂತ ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡ್ತಾರೆ. ಪೇಷಂಟ್ಸ್ ಆರ್ ಅಗ್ರೆಸಿವ್, ಅಜಿಟೇಟೆಡ್, ಫುಲ್ ಗದ್ದಲ ಹಾಕ್ತಿರ್ತಾರೆ. ಆ ಗದ್ದಲ ಹಾಕಿದ್ದಕ್ಕೆ ಅಲ್ಲಿ ಸ್ಟಾಫಿಗೂ ಮತ್ತು ಬೇರೆ ಪೇಷಂಟಿಗೂ ತ್ರಾಸ ಆಕೈತಿ. ಅವ್ರಿಗೆ ನಮ್ಮದು ನೋವು ಕಮ್ಮಿ ಆಗ್ಬೇಕಂತಂದು ಎಕ್ಸ್ಪೆಕ್ಟೇಷನ್ ಇರ್ತೈತಿ. Then these are the scales used for pain assessment. This is pain triage. In this numerical pain scale andre pain is divided from 0 to 10, 0 1 to 10. The 0 to or 1 to 4 is green zone, then 5 to 7 is yellow zone, then 8 to 10 is red zone. Depending on the amount of pain, The scale is given. The disaster triage. The goal of disaster triage is to do something good for most of the people. So disaster ಅಂದ್ರೇನು, there is bus accident, car accident, or a major calamity, blast or something. So what is aim of disaster triage? The aim of disaster triage is to help maximum people whom we can save, shift from individual patient to focus on entire affected population. In order to maximize benefit to entire population, healthcare professional may need to let some people die with comfort care only. Under true disaster conditions, CPR should not be performed. Then minor respiration, if yes, over 30 minutes, immediate care. No position airway, no respiration disease. Then if there is respiration, immediate care. Then after respiration, there is checking for perfusion. Radial pulse absent or capillary refill over 2 seconds. Under 2 seconds, check for mental status. Can follow simple command, can be waited. If cannot follow simple command, immediate care. If the capillary refilling time is more than 2 seconds and bleeding needs to be controlled immediately. Simple triage and rapid treatment. Then telephone triage. Then conclusion. Triage is a fundamental part of clinical risk management in all departments. When clinical loads exist, clinical availability, triage is not designed to judge whether patients are appropriately in the emergency setting, but to ensure that who needs care in appropriately quickly. Triage system should be teachable, auditable method, assessing clinical priority in emergency settings.